everybody, it's Adam with HeartValveSurgery.com, and we are at the Endoscopic Cardiac Surgeons Club meeting in Northern Kentucky. I'm thrilled to be joined by Dr. Mario Castillo-Sang.
Hi, Adam.
Who is a minimally invasive expert specific to valve surgery. He's also the program director of this meeting. Also thrilled to be joined by Jude Sauer, who is the founder of LSI Solutions. Jude, nice to meet you.
Nice to meet you, sir.
Dr. Castillo-Sang just performed a live operation, shared techniques with the attendees of this meeting. I saw things that I have never seen before. You've been talking about the advantages of endoscopic techniques, specifically with long shafted instruments, and the possibility of now scaling these techniques. What's empowering endoscopic interests that has made so many people come to this meeting?
Adam, I think you bring up an excellent point. If you go historically, since 1997, we have been doing endoscopic cardiac surgery. In fact, the person who started it is in the auditorium right now, Hugo Vanderman. He was doing this with a two-dimensional scope, with instruments that were adequate but not excellent. Today, the reason why this is picking up and getting more exposure is because the surgeons now have a lot more armamentarium to carry out the operation, the techniques, deliver it safely, efficiently. LSI is one of those companies that has facilitated many of these things. My staff will tell you that I always say there are two things that facilitated cardiac surgery. One is long-acting cardioplegia. That's a solution with which we stop the heart. And now we can give it and have the heart arrested, safely stopped for 80 minutes. In the past, every 15 minutes, we had to redose the medicine. That's one. The second one is something called a Cor-Knot. Incredible tool, talking about facilitators. This is an auto tire, if you would. Usually surgeons will tie with their hands, and if you're doing it minimally invasive, you push the knot with a long shafted device. Okay, we call them chopsticks. But today, almost every surgeon in the world, instead of tying, uses this automatic suture fastener.
So you saw that as a defined need for the physicians that would ultimately help the patients. Is that correct, Jude?
Yeah, I actually invented it for pediatric surgery for innocent fundal applications more than 30 years ago. But it was an overnight thing that we've turned into something that's helped patients now. We have over 20 million fasteners in patients across the world.
Well, on behalf of those patients, thank you for the vision that you've had. And I've got to ask you, you've mentioned this word scope several times in the auditorium, in our interviews together. And this, what I found was a big distinction in the approval of a scope just recently. Can you tell the patients all about that?
So in the past, as I mentioned before, we were using a 4K high definition but 2D scope. Last year, the FDA approved the 3D scope, and we are using that now because it gives us that depth perception, right? That ability to measure distance unconsciously without having to actually do an effort. And that accelerates the process. To give an example, I put 20 stitches to replace a mitral valve. But every time that I was placing 2 at a time, automatically. And you can see that where I'm going with this. The process is accelerated, it's efficient. The combination, the synergy between the 3D scope and having those double sutures pass at the same time are giving us the ability, the tools to do these operations a lot faster, safe, efficiently, and through a tiny little hole.
So if I understand it right, for all the attendees who are coming here, they want to learn about these techniques that you've worked years and years on with folks like Jude and the LSI team. This is some kind of training lab that we're looking at here.
It's a training village that the team from LSI has put, so all the attendees can come in and first see what 3D looks like. Now put your glasses on. Okay. And I'll take out the bacon. Do you have a debate or forceps?
Oh, wow.
Yeah.
You see that?
Wow. I really would love to put this
really
there so you can see
I know.
it really.
You can't really see it, right?
Yeah.
And there it goes.
Wow.
It's pretty
2 at a
to do by
time.
hand.
Wow. This is something where you then could attach to a valve.
Exactly.
And then
That's how
implant the valve right.
That is correct. If you look at the screen, it's showing a video. That's how the valve is sutured in place. That's how it's lowered into the chest. And that's the incision. It's a super tiny incision.
Having a suture is one thing, but placing a suture is a different thing.
It does on. You're going to position it right here.
In between the two.
You're gonna preload your needles. You go all the way, you'll fire completely, but just go a little bit. Okay. So then you go in and keep looking at the screen. Start pre-deploying your needles.
Oh my.
Pre-deploy your needles, a little squeeze, like a gentle squeeze. Okay, now open. And there it goes.
Oh my.
2 sutures at once. Does that make sense?
Wow.
And keep pulling out. It's kind of fun to watch it come.
Whoa.
Keep going.
And they stay in order. They stay organized, right? Because
Oh, that is unbelievable. And again, I can't thank you enough.
Oh my gosh.
For the transformation this is having on patients. How did the patient do today?
really well. The patient was extubated in the operating room at about 30 minutes from finish of the operation and is in the intensive care unit, doing very well. How are you, Mr. Erickson?
I'm doing really well. Today is great. It doesn't hurt to breathe. I've walked 10 laps through the hallways in the hospital. I'm just totally amazed at how incredible this procedure is.
And your expectation for this patient to go home, today's day 0 in terms of recovery. When do you think the patient will go home?
2 to 3 days.
Amazing, amazing. Well, again, thank you to everybody here, and Dr. Castillo-Sang, thanks for your support of
thank you for
HeartValveSurgery.com
doing all this for our patients.
and all of our patients. Hi, everybody, it's Adam. I hope you enjoyed that video. And don't forget, you can always subscribe to our YouTube channel, watch the next 2 educational videos coming up on your screen, or click the blue button to visit HeartValveSurgery.com.